Move now to the Minister for Health, and I call Cheryl Brownlee.
In January 2022, I formally announced the setup of the regional insulin pump service to mark the 100th anniversary of the use of insulin to treat diabetes. This announcement, supported by £2 million worth of funding by my department, enabled this life-changing service to be established. This investment makes provision for both pump devices, together with the specialist workforce required to support people living with type 1 diabetes to receive insulin pump therapy. The aim of the regional service is to improve the lives of people living with type 1 diabetes, and the regional insulin pump service was co-produced with people living with diabetes, clinicians and healthcare professionals across all health and social care trusts alongside Diabetes UK. Our service goal is to provide equity, reduce variability and enhance outcomes for people living with diabetes across all of Northern Ireland. Centrally, quality of life is a key consideration in pump decision making, and I'm proud to report Northern Ireland is the first of the regions across these islands to have made quality of life a key criterion. Following a formal commissioning process, Belfast Health and Social Care Trust were selected to deliver this service. A regional multidisciplinary team delivers this insulin pump pathway, connecting with local health and social care trusts to provide a high-quality service. In year one, the service has begun a rebalancing exercise across the region, and this directly supports the ambition of equity as our chief priority. I'm pleased to report that following successful steps to support the longest waits in the context of available workforce, the regional insulin pump service will be fully operational as from today, Monday the 4th of March 2024. So without doubt there's still much work to do, but we have built firm foundations and most importantly, work has begun.
Ms. Brownlee.
Thank you, Minister, for your response, and I indeed welcome that. I understand the Department of Health recently endorsed the NICE recommendations regarding the hybrid loop system for those with type 1 diabetes. Could you provide an update on the implementation of these recommendations?
And I thank the member for her query in regards to the closed loop service, because actually in December 2023, as the member stated, NICE updated guidance with recommendations on the use of a hybrid closed-loop system. The guidance provides evidence-based recommendations on hybrid closed-loop systems for managing blood glucose levels in type 1 diabetes. Subsequently, Department of Health Medicine's policy branch, which sits within my Chief Medical Officers group, reviewed that guidance and has formally endorsed that it is applicable in Northern Ireland. So in line with NICE guidance and the recommendation, that work is being undertaken by my officials to develop an options appraisal. This will allow me to understand the implications of this decision in terms of overall provision, consideration of priority groups, system costs, workforce and communication requirements to both enable and support. So this information will inform commissioning arrangements for Northern Ireland and final decision making regarding the implementation by my department. But it is worth noting that NHS England has developed a phased implementation strategy over a 5-year period in response to the guidance, and this decision has been taken in response to the scale and scope of this recommendation.
Ms. Sheeran.
Thank you, Minister. You'll recall that during the last mandate I wrote to both yourself and subsequently the Permanent Secretary about the commissioning of Dexcom devices. They're continuous blood monitoring devices that have been described to me as revolutionary for people with type 1 diabetes, and they work in conjunction with the pump. I've got constituents who are entitled to a new pump,
please,
but can't avail of it because they haven't got the Dexcom device. Can you advise if the decision to commission these devices in the north will be reconsidered?
Minister.
And I thank the member for her point, because in connection with, I think, the last supplementary, those continuous glucose monitoring devices are steadily becoming a more in-demand way of monitoring diabetes control for people on intensive insulin therapy. And there are many such devices available to support people living with diabetes. The NICE Resource Impact Report for Continuous Glucose Monitoring Recommendations that was published in March 22 states there is no advantage to recommending one specific device over another. So the most appropriate system for each individual is the responsibility of the Health and Social Care Trusts and their clinicians to determine, actually in consultation with the person living with diabetes and on their care. The strategic planning group within my department commissions standalone CGM devices, and this is in line with identified commissioning needs within limited resources and is recommended in the NICE clinical guidelines for people living with diabetes. There are CGM devices currently listed on the Northern Ireland Drugs Tariff. Other more complex CGM devices are not currently listed on that tariff and cannot be prescribed by primary care. But I'll follow up with the member if she has written to me and ensure she gets a response.
Can I just ask, a national diabetes audit was announced in 2016 with the diabetes strategic framework. It's yet to be carried out, and I'm just wondering if you will commit to establishing a diabetes audit within your within this mandate.
And I thank the member for her point. I'm not fully aware of the 2016 recommendation, but in regards to the steps that we are taking in regard to supporting people living with diabetes, both from the regional pump framework that we have set up, but also how we look at other advances in support mechanisms, should that be the closed loop system or other systems as well. I'll take that on board and get back to the member.
I listened to the Minister there as he committed to working on NICE guidelines, options appraisal and commissioning various arrangements. Is the Minister then developing a strategy for diabetes, and if so, when will that strategy be available, and what level of commitments will be made to that financially and resource-wise, please?
Minister.
And I thank the member for his question in regards to how we look at our overall service in regards to supporting people living with diabetes and their carers as well, and also how we make sure that NICE guidelines in regards to changes in support devices, should that be closed loops or the CGMs, is also taken into a wider piece of work in regards to where we actually sit. As I've said earlier on, in regards to some of those additional devices in regards to NICE guidelines, we're seeing what's currently been done in England in regards to a phased rollout of that. In regards to a specific strategy, there's not ongoing work at this minute in time, but in all the other steps that I have identified in regards to the work that has been done within my department, it shows that we are committed to supporting people with diabetes as we see the evolving setup within how their treatment can actually be supported and evolves.
Tim Alistair.
On the timeline on the hybrid closed loop system, do I discern from the Minister's answer that it's pretty long term, that you're waiting and seeing what's happening in GP, and that you may take refuge in a phased rollout? There's not a lot of comfort in that, people who are waiting day upon day for such help, is there?
Minister.
I thank the member for his point now, and I know where he's coming from in regards to this, but it's not about taking refuge. It is about identifying to the House and updating members in regards to the process that has been taken in England, that they are looking about a phased implementation strategy over the next 5 years. But I do need to be clear, Speaker, that the significant additional investment that will be required to support the implementation of a hybrid closed loop system to people living with type 1 diabetes will be significant in regards to what we're doing. But again, it's how we look towards the phased implementation of this and looking to see what can be best learned from those in England as we look to see and learn from other colleagues as well.
Mr Buchanan isn't in his place. I call down Dodds.
Thank you, Mr Speaker. Question number 3, please.
And I thank the member for her question. I'm glad to have been asked about the cancer strategy, as I consider it one of the most important documents currently within my department. But as members will recall, it was published in March 2022 with the aim of transforming our cancer service to ensure better care for those who need it when they need it. But with the crisis in cancer services so real and so serious, I'm always clear it couldn't be allowed to become yet another strategy sitting on a shelf. And the absence of an executive did unfortunately limit some of the potential in that time since. But thankfully, over £11 million a year recurrent funding has enabled work to commence on the delivery of some of the actions. In December 22, rapid diagnosis centres at White Abbey and South Tyrone hospitals saw the first patients. Those centres allow people who would not otherwise be eligible for a red flag referral to receive an earlier diagnosis of cancer. And that addresses the major challenges in haematology, as well as a review of the three main blood cancers, has actually recently been completed, and an implementation plan is expected shortly. In addition, a review of adolescents and young adults cancer support has been completed, and draft minimum standards for the treatment of adolescent and young adults has been developed. My officials have also encouraged partnership working with the voluntary and community sector and have fostered new ways of working relating to pancreatic cancer. And as a result, Northern Ireland was the first part of the United Kingdom to commit to implement the pancreatic cancer optimal care pathway. And going forward, there is undoubtedly more to be done. But with long-term investment in our cancer services, I am confident that we can start delivering improved cancer outcomes for the people of Northern Ireland.
Mrs. Dodds.
Thank you. Minister, your strategy indicates that you will require a total of 145 million or more per year in order to fully develop the strategy towards its end. That obviously increases through the years, starting from 2022. Will you ensure that that funding is ring-fenced in your budget so that we can continue to improve cancer services?
Minister.
I thank the member for her point, and I thank the member for her support on this issue, because I know where she's coming from. Having listened intently to the Deputy First Minister's answers earlier in regards to the need for a recurrent budget, in regards to how we actually move forward, that's one thing I would ask everyone in this House to fully support and endorse, because we've always been vocal in health that a single year budget doesn't allow us to do the transformational pieces, nor commit in the long term to those strategies that we costed when we produced at the same time, so people knew how much they would cost, but also what they would be getting for their money as well. So in regards to that, I'm looking forward in anticipation to see what budget I actually get next year before I can make any commitments to ring-fencing any allocation, unfortunately.
Liz Kimmins.
I want to thank the Minister for his answer on this very important issue, and the Minister will know that the 17,000 women in the Southern Trust area who are involved in the cervical smear review, many of them will still be very anxious, so I would ask the Minister if he can give an update on the progress of that review and when he anticipates that may conclude.
Minister.
I thank the member for her supplementary. She may be aware that there's another member has that question tabled at question 7, and while I will give her an initial answer in regards to the work that has been done, women affected by the review in the Southern Trust will receive letters from the Trust over the next few days to update them on progress to date on further timescales, but I will update later if we get to that question.
Minister, could you indicate to the House how the Encompass project has impacted on red flagging cancer cases, and is there a positive outcome from that?
I think the member for his supplementary, it is something that one of his party colleagues has raised directly with me in regards to that. There has been a piece of work in regards to the identification of pathways to make sure that everybody who received further notice in regards to treatments, in regards to the example of 4 red flags, that those clear pathways were established within our system. The learnings we have from the South Eastern Trust and its implementation and rollout will now be actually embedded as we go forward, and hopefully see the initial start of Encompass rolling out across the Belfast Trust in the summer.
Thank you, Mr. Speaker. Minister, I especially welcome the continued operation of the 2 rapid diagnostic centres that the Minister opened in 2022. Could he provide an update on any plans to make the centres available across all of Northern Ireland?
Member, and I think that is an important question as to how we actually take what we're doing now, but also future-proof it and develop in the future, because what was established in those rapid diagnostic centres was so that a vague symptom pathway for patients with non-specific but worrying symptoms, which may indicate cancer, is now available in 4 out of the 5 trust areas. There are plans now to make this service available across the entire region by this summer. And additionally, a project group has been established to consider new cancer pathways where the rapid diagnosis centre model could actually improve outcomes for patients.
David Loughlin.
Thank you, Speaker. Minister, this is Ovarian Cancer Awareness Month. What steps do you intend to take in order to raise awareness of this particular disease? And do you believe that it needs more funding in order to make sure that people are aware of what the symptoms are?
Minister.
And I think the member, the original question from Mrs. Dodds actually went back to about the cancer strategy. One of the first aims, the enablers of the cancer strategy was actually to raise cancer awareness across all the different sectors, all the different subspecialities within cancer, in regards to make sure that people were aware not just of symptoms but of treatment pathways, but also to get that wider conversation about cancer actually across society within families, so that if people had those troubling, niggling symptoms that they didn't maybe feel they should be going to the doctors with, that they were being encouraged within their families to actually do that. So that was the key enabler of the cancer strategy. And as an answer to the previous member, how we actually moved that forward about those rapid diagnosis centres as well. So, and specifically in regards to the Ovarian Cancer Awareness Month, my department will be supportive of any request we do receive in regards to highlighting what steps are being taken and how we can make sure that people are aware of their symptoms, potential identifiers, but also what services and what support is available.
Call Carla Coolan.
Question number 4, please.
And I thank the member for her question. Addressing the harm related to alcohol and other drugs is a key priority for my department, which leads in the Northern Ireland's Executive 10-year substance use strategy, preventing harm, empowering recovery. This strategy aims to directly prevent and reduce the harm related to substance use through a range of cross-departmental actions and support. We are seeing increasingly complexity of cases in both mental health and substance use services, as well as in those presenting to emergency departments. It is vital that there is no wrong door and that people get the right treatment at the right time, particularly when presenting in crisis. Implementing the new Regional Crisis Service is a commitment in the Mental Health Strategy 2021-31, and the Strategic Planning and Performance Group and our Public Health Agency are working in partnership to develop a regional mental health crisis service for Northern Ireland. Currently within trusts, dual diagnosis services vary in relation to how and where they are offered, with treatment and support being located within addiction services, early intervention support services or acute mental health services. So the issue of dual diagnosis or co-occurring mental health and addiction problems is a key priority within both the substance use strategy and the mental health strategy. Therefore, it's critical that we reinforce linkages with the mental health strategy's early intervention and action plan and the development of that regional mental health crisis service and the development of the regional mental health service to devise better pathways and models for those mental health crises and with co-occurring addiction problems.
Mr. Hewlett.
I thank the Minister for his response. He knows me well enough that I'm not saying this lightly, but that will not mean anything to families or indeed police or community groups who are in ED from Thursday to Sunday to Monday with people who are struggling in crisis through drugs and alcohol or both. So perhaps when the budget is confirmed, will the Minister give more security to those very services who are under threat, including the staff who are working under extreme pressure in our emergency departments right across the north?
Minister.
And I do know the member well enough that I'll accept what she's saying because of her engagement, but also for her passion and her commitment in this area. And she knows me well enough in that regard as well. When the money and the funding does come forward, co-occurring mental health and addiction problems and also those dual diagnosis problems were of an importance to me that they are both in the substance use strategy and the mental health strategy, because they don't fit neatly into either one, and there was always a concern that those people identifying were lost and they were falling between both sets up and both strategy. And it's how we work then, not just in health to address this problem, but also working with our PSNI colleagues and also working with the voluntary and community sector who play such a crucial role, even in supporting those people who present to EDs in regards to the challenges that they face as well. So there's a big piece of work to do in this in regards to what both these strategies actually intend to produce, but also what they want to produce as well, and that will be needed and supported by the funding allocation.
Thank
you, Mr. Speaker. Sadly, in recent years, we have seen a sharp increase in drug deaths across Northern Ireland. I would like to ask the Minister what he's doing to increase accessibility to naloxone and to progress an overdose prevention centre.
Minister.
I thank the member for both his questions there. In regards to the increased use of naloxone, it's something that actually his party leader, as Justice Minister, and I have promoted in regards to how we can work with those support services, not just our blue light services in regards to my own blue light services, an ambulance or fire brigade, but indeed the PSNI as well, but also how we can use that across other community settings that do have the appropriate support. In regards to the Overdose Prevention Centre, the member will be aware that drug consumption rooms or safety injecting facilities actually aren't permitted under the UK-wide Misuse of Drugs Act 1971, and the issue of criminal sanctions for those found in possession of drugs still remains under that, is governed by the Misuse of Drugs Act and remains a reserved matter. There are currently pilots for overdose prevention facilities being progressed in Glasgow and Dublin, and I will give due consideration to the new interventions as appropriate, actually within a wider legislative framework.
I call Mr. Colm McGrath.
Thank you, Mr. Speaker.
I thank the member, and again following up from his urgent oral a couple of weeks ago, pay negotiations with Agenda for Change trade unions completed on the 22nd of February, and I wish to commend the constructive approach of trade union colleagues to negotiations. Under the proposed settlement, our Health and Social Care Agenda for Change staff will receive a consolidated pay uplift of 5% and a non-consolidated pro rata payment of £1,505. In addition, any remaining staff in Band 1 and staff on the lower point of Band 2 will have their pay increased to match the higher pay point of Band 2. These awards will be backdated to April 2023. Unions are now consulting their members, and I want to give them the time and space for this to happen. In terms of medical pay, I have asked officials to move to immediately implement DDRB recommendations for 23-24 pay for all doctors and dentists employed in health and social care. That represents a pay uplift of 6% for 23-24 for all doctors, plus an additional £1,250 for doctors and dentists in training, known as junior doctors, and an additional 3% for new contract SAS doctors. For junior doctors, the DDRB recommendations offer an average pay increase of 9.1% in 23-24, and those in their first year receive a 10.7% uplift. This offer should be viewed in the context of pay settlements across the wider Northern Ireland public sector. The Speaker, despite this offer, junior doctors have indicated their intention to take strike action for 24 hours over the 6th to 7th of March. My department remains willing to engage with the BMA to discuss the way forward on outstanding issues. That includes a commitment to further engagement on pay, on contract reform and non-pay issues relating to working conditions. Any pay discussions will of course be better informed when there's greater clarity with respect to the outcome of the current industrial action being taken by doctors in England.
I'm the Minister of the 2-minute rule, Colm McGrath.
Junior doctors are telling us that their pay has diverged from other places in these islands by 30%. Does the Minister believe that our junior doctors are worth 30% less than their colleagues elsewhere?
Minister.
And I thank the member, and I'll follow on from the discussion we had when he raised the urgent oral. The 30 to 35% divergence is actually from where they would have been in 2008 should inflationary pay increases been actually enabled year on year. The member will be aware that that was a national decision in regards to how that was taken in regards to the national funding. It's not an issue that I think should be left solely to the Department of Health to sort out what was national and international decisions taken over that period of time in regards to the financing.
Linda Dillon.
Karen Corley, and thank the Minister for his answers so far. Minister, in the same vein in relation to the junior doctors and the challenges that they face, can you give us an update on what you plan to do around the workforce plan and how we're going to have a workforce if we don't pay them adequately?
Minister.
I thank the member for her comments specifically in regards to the workforce plan and the workforce strategy. She will be aware my department's ambition for developing our workforce are outlined actually in the Health and Social Care Workforce Strategy for 2026, Delivering for Our People, and I'm pleased to publish the strategy's second action plan for the period 23 to 24-25. That was published back in June, and this was developed through widespread engagement with stakeholders from across health and social care, and the implementation of that ambitious programme of work is ongoing and includes initiatives to enhance our attraction and retention of staff while removing barriers to recruitment. It also reduces agency spend and supports employers in the provision of staff health and wellbeing services.
Desmond.
I'm grateful if the Minister could provide a more detailed update on the implementation of that workforce strategy.
Sir.
I thank the member in regards to that. As I've said, we have published those updates, and I'm committed to working with stakeholders from across the system in the continued implementation of this strategy. However, again, I would caution my department will require significant funding to do that. But, Speaker, it is encouraging to note that this strategic approach to workforce development has actually supported an additional 8,911 people. That's a 15.7% increase in the whole-time equivalent staff employed directly by the health and social care sector in Northern Ireland between March 2018 and December 23. So that workforce strategy has seen nearly 9,000 additional whole-time equivalent staff employed in our health and social care system.
Neil McAllister.
Thank you, Mr. Speaker. I'm thankful for the Minister's answers so far, specifically around workforce and pay negotiations. And I want to go back to the first few questions around the pay negotiations. With regards specifically around junior doctors, what discussions has the Minister had around working conditions that could be alleviated in the now, rather than waiting for the overall safe staffing legislation, which we are unsure when it's going to come to the Assembly floor?
Minister.
And again, I thank the member in regards to safe staffing. It is a piece of legislation that I do want to bring forward. It's in my legislative programme for the incoming year if the Executive supports that. So I'm committed to introducing that bill within this Assembly mandate, and work continues in partnership with those key stakeholders to ensure that a consultation document to inform the development of safer and effective staffing legislation is actually ready for publication later this year. I've said to BMA and junior doctors specifically, and they want to come in regards to have that conversation with me about those additional things, about their conditions, their working conditions, how they're actually being treated and managed within their trusts. I'm open to have those conversations. Once we get over Wednesday, I hope to be able to engage further with the Junior Doctors Committee in regards to the BMA in regards to those, and I'm always open to that engagement.
Question 6 has been withdrawn. I call Owen Tennyson.
Mr. Speaker.
And I thank the member for his question. The ongoing cervical cytology review in the Southern Health and Social Care Trust includes up to 17,500 women and has two elements: a review of the cervical screening slides held by the Trust for women who have had a previous smear test, and a call forward inviting women to have a new cervical smear test where a previous slide is no longer held or is no longer suitable for review. As of the 20th of February, 2,564 slide reviews have been completed, and the Trust has called forward 1,960 women to attend for a cervical smear test, which 621 women have attended to date. An additional 2,255 women with the overall review cohort have already attended for their next routine cervical smear test, which will remove the need for these women to have their older slides reviewed at their latest test, will actually provide the most up-to-date and accurate assessment. My department continues to work closely with the Public Health Agency and Southern Health and Social Care Trust to ensure that the review is progressed in a safe and timely manner. This is a complex review. Plans are now well advanced to increase the number of slides to be reviewed on a weekly basis, with the intention that the full review will be completed by early summer.
I thank the Minister for his answer. The Minister will be aware that NHS England has set a target of eliminating cervical cancer by 2040. I know the Minister has recently set out his plans for a Women's Health Action Plan for the next 3 years, but will he also commit to a women's health strategy to extend a similar target to Northern Ireland?
And I thank the member for his question, which is a very, very important point in regards to where we actually move in the development of our Women's Health Action Plan, from actually taking to that next step in regards to developing a strategy from the action plan. We have announced the introduction of PHPV testing, which I hope, when introduced, will not only significantly remove the backlog that we currently have, but will also speed up the ability to report on those slides and those tests as well. So there is those steps that are being taken in regards to addressing that issue.
I now move to topical questions. And just before I call Mr McGrath, there is an urgent oral question that's been accepted to the Minister of Health and Nexus NI, so no member should raise that issue before the urgent oral. Mr McGrath.
Mr Speaker, during the most recent collapse of these institutions, the Department reduced the amount of funding, or rather slashed the amount of funding for the core grant of the community and voluntary sector, impacting some 62 groups. Does the Minister think that it's fair that these groups had their funding slashed so drastically?
Mr Speaker, I don't think it was fair that the Department of Health actually had its funding slashed so dramatically, and maybe under the similar conditions in the forthcoming financial year as well. So what, I suppose, measures that had to be taken in the absence of an executive, a minister and a recurrent budget are drastic, and I hope that next year's budget is in a better position.
Thank you, Mr Speaker. Given that this grant is so core to the work that they do and the ability to draw down additional funds which help people in our community, can the Minister detail, does he intend to write to the Finance Minister specifically on this issue to ensure that additional funding is given for these groups?
Minister.
The Finance Minister has already indicated her direction of travel in regards to how we prepare a budget for the next year, and that will be on one-to-one engagements with each minister, each department in regards to their core needs, not just for the likes of our voluntary and community sector, but how we actually fund what we want to do in health across the entirety of that sector. So those would be engagements and discussions that I'll be having with the Finance Minister in regards to what our overall financial package looks like.
Thank you. Minister, could I ask what your department is doing to bring down the long waiting lists for access to ADHD medication?
Minister.
And I thank the member for her point, because she will be aware that while supply disruptions of some attention deficit hyperactivity disorder ADHD treatments have now been resolved, my department is aware of ongoing supply disruptions involving various strengths and preparations of other ADHD treatments across the UK, which has been caused by a combination of manufacturing issues and an increase in global demand for these products. So as the Department of Health and Social Care leads on the maintenance of medicine supply chains to the UK, my department has been working closely with them and the other devolved governments and the Medicines and Health Care Products Regulatory Agency, MHRA, to ensure the impact of these shortages are mitigated and patients can continue to get medical supplies that they need.
Thank you, Minister, for your answer, and I very much welcome the fact that you are looking towards this. But what is your department, and how will you be able to prevent any inconsistencies across trusts when accessing ADHD services and medications?
Minister.
And I think the member, for her point, she has moved slightly away from medication into services, and she will be aware there is a disparity across our trusts in regards to ADHD supports, and especially now as we see an increased presentation in adult ADHD. There isn't a commissioned service for that at this present time, but it is something that is being looked at by my department officials in regards to how we establish that pathway and indeed identified, and how we use the current supports that we currently have in regards to supporting those people who are presenting.
Mr Speaker, I recently tabled a written question to the Minister regarding Veterans Orthopaedic Service, and in that response the Minister highlighted that the Armed Forces Act 2021 was the responsibility of FM-DFM to implement. Can the Minister advise when he will expect to receive further instruction from them regarding his department?
Minister.
I thank the member for his point, and I know this is a topic that the member has risen with me and has a strong and close interest in. He rightly points out the responsibility for implementing the Armed Forces Act and taking forward the New Decade New Approach commitment of legislation actually to further incorporate the Armed Forces Covenant does lie with the First and Deputy First Ministers. And whilst I sincerely would like to see progress in this regard, I'm unaware as to any of the most recent instructions, and after today's session I'll ask my officials to engage with their counterparts in TEO to try to ascertain if or when further direction or clarity will be forthcoming to my department.
Mr. Allen.
Minister, it's been raised with me by several veterans that they're struggling to access the Robert Jones and Agnes Hunt orthopaedic service in the mainland, whereas their counterparts in the mainland and other parts of the United Kingdom are able to access that service. Will the Minister commit to meeting with me and his officials to discuss this matter?
Of course, as the member is supportive of me in this role in regards to what we can do, I'll be keen to meet with him in regards to these issues that he raises.
Thank you, Mr. Speaker. The Anna and Waterside GP medical practices at Portadown Health Centre account for nearly 10,000 patients in my constituency in Portadown. Their notice to withdraw and hand back GP contracts has caused much concern. What assurances can be given to these patients about continuity of care provision?
And again, I think the member for the issue he raises in regards to GP contracts, he will be aware that unfortunately the two practices that he mentioned are not isolated occurrences in regards to that, but I can say to the member that for those contracts that have been handed back, we're not in a point at any stage where we've actually seen a practice having to close due to the other options that have been brought forward either by other trusts, GPs coming forward to take on those contracts, or trusts actually taking them over, or indeed local GP federations stepping in to that point as well. So there is a number of months to go in regards to that position, and I would ask the member to give that reassurance to his constituents, that I will, but also to work with my department and the GP Federation in trying to identify and support any future provision in regards to that, and give that reassurance and stabilisation not just to the patients but to the people who are working in those practices.
Mr. Buckley.
Thank you, Mr. Speaker, and I thank the Minister for his answer, and indeed I am thankful for the Department and the manner in which they have stepped in thus far. But he will agree with me that this is an alarming reoccurring situation, particularly with one of the practices. Is the Minister aware of any similar practices across Northern Ireland that are in a similar position on the brink of handing back their contracts?
Minister.
Unfortunately, yes. There are a number of GP practices in a similar position, and as I said, my department is working with our colleagues in GPNI and also the BMA committee in regards to what can be done to actually stabilise those current positions, but also look to the future of the GP contract, because I want to ensure that our general medical services contract that is in place is actually fit for future purpose and can actually better meet the changing environment and context of primary care. So discussions with the Northern Ireland General Practitioners Committee on the 24-25 GMS contract and beyond are currently ongoing, and my aim is that these negotiations is actually to promote stability in our GMS service.
Samuel Holland.
Can I ask the Minister for an update on his department's action plan on the recommendations of the Ray Jones review into social services?
Minister.
I thank the member for her question. I'm actually due to meet Ray Jones next week in regards to the recommendations for the work that he does, because if the member has made herself aware of it, she will realise it's a very detailed, very in-depth piece of work. It was co-produced very astutely with Mr Jones at the head of it in regards to that, and I was actually pleased to be asked to be speaker when it was launched recently in the Stormont Hotel. So I'm due to meet Ray within the next week or so in regards to what steps we're doing, but also to identify those pieces of work that have already been taken forward, but those more challenging pieces of work which sit within his recommendations that will require not only the support of this House, but will require significant change within the Executive in regards to how we look at that wider piece of children's social care.
Ms Mulholland.
Would the Minister agree with me? So one of the mechanisms, obviously, for the protection of at-risk young people is the use of the national referral mechanism. Figures out last week showed there's 530 of those used within the last year. Would the Minister agree with me that we need to be working more with our health service cohort to actually raise awareness of that as a mechanism to protect children who are in danger of criminal child exploitation, and that is something that could be utilised more by the health service?
Minister.
No, and I think the member raises something that has been in the media recently in regards to that, because I will say to the member on the House that any form of child abuse, including exploitation, is totally unacceptable and must be appropriately addressed, and all children and young people in Northern Ireland are entitled to live in safety, to achieve their full potential and have their rights respected. The prevention of and the protection from abuse, including exploitation, is a complex matter with many risk factors requiring input from a range of statutory and non-statutory partners, and I think that's the point the member raises in regards to making sure everybody is aware. In 2023, my department, working jointly with the Department of Justice, led a 2-year action plan to address child criminal exploitation in Northern Ireland, and this was done under the auspices of the Child Protection Senior Officials Group, which is a cross-departmental strategic forum which provides direction on existing or emerging child protection issues, and my department actually chairs that work as well. So in regards to, I suppose the wider point is it's about how we make sure that that information, those direct routes of referral, those direct routes of support are communicated across the entirety of our service.
Owen Tennyson.
Thank you, Mr. Speaker. Minister, given the prevalence of the sale of vapes to underage children and also the associated environmental concerns, do you have any plans to introduce legislation to ban the sale of disposable vapes?
Minister.
I thank the member. In regards to banning the sale of disposable vapes, I'll take a point of clarity at any point, but I do think it falls within his party colleague, the Department, the Minister of Environment and Agriculture, in regards to actually disposing or preventing the sale or banning the sale of disposable vapes. But there is a piece of legislation that I'm currently working with my UK Health Minister colleagues, and I met this morning with the Secretary of State for Health, Victoria Atkins, in regards to how we actually bring forward Northern Ireland's place within the tobacco and vaping bill that will be currently, or will be shortly, be brought through Westminster in regards to how we look at the sale of tobacco products, but also look at the wider piece in regards to vapes.
I thank the Minister for his answer, and given what he said, will he commit to engaging with DAERA and maybe come back to me at a future date with some clarity about who the lead department is on that issue?
Minister.
I thank the member, certainly I will, and I think of actually a request out this morning to meet the member's party colleague in regards to that, and I'm sure either one of the two of us will update you at the appropriate point.
I call Mr. David Honeyford.
Speaker, can I ask the Minister, given the recent publication of waiting times, when the data from the South Eastern Trust area will be made available, and whether Encompass has helped to reduce those waiting times and help to improve matters?
Mr.
I think the point, I thank the member for his point in regards to the validation of statistics within Northern Ireland, and it is something that we take very seriously, both from ourselves but also NISRA and the information, the IAD device and what we publish. So in regards to that delay of the South Eastern Trust's figures not being there, it is until we get them completely validated in what is a new system. I do hope that Encompass actually produces a more streamlined, safer healthcare record systems in regards to what it actually brings forward, because it has been brought forward at a significant cost to the Department of Health in Northern Ireland, and I look forward to that information that will be held on those computer systems actually leading to a more effective, safer healthcare system in Northern Ireland.
Mr. Honeyford.
Thank you, and thank you for your response. I get a lot of concern raised locally from healthcare staff about morale around the service, and it's vital that people work in a place with high morale and look forward to going back to work. Can the Minister outline what he's doing to inspire and give leadership and positive leadership to make sure that it's vital that our health service staff work in a positive working environment with high morale?
Minister, succinct response, please.
And I think the member, I've engaged extensively since my return to office with healthcare professionals across the system. Actually, one of the things that is giving our healthcare system staff a sense of, I'll not say it's high morale, but improved morale, is the fact that we're back in this place, because our health service really values and recognises what this place can actually bring to them, their working conditions. And I think that has been demonstrated by once again I was able to bring forward an offer for a pay resolution for our Agenda for Change staff, something that this place wouldn't been able to do. But our staff morale isn't based solely on money, it's about the reward for the work that they do, and the member will know that we have a highly dedicated, a highly professional cohort of people working across health and social care, not just within our system but within GPs, community pharmacy, domiciliary care, and no matter where they're found. I think we should be applauding them and thanking them for the work they do, rather than often coming to this place or the media to actually deride some of the work that they do.
That concludes questions to the Minister. We have an urgent oral question from Cara Hunter to the Minister of Health. I'll remind members that if they